Hello, my name is Drew Johnson with Pivotal Whole Health here in Coeur d'Alene, Idaho. This segment, I want to talk about hormone replacement therapy. And I was actually reviewing a book here called Age Healthier, Live Happier by Gary Donovitz. Gary Donovitz is owner and inventor, if you will, of the hormone replacement company called BioTE, Bioidentical Hormone Replacement Company. People in the past, if you go to a general practitioner in general, if you will, or you'll get your hormones tested, your testosterone or your estradiol in the women, and even testosterone in women. And there's highs and low normals. Every lab value has a normal value. And most practitioners don't understand if your testosterone is between 264 and 964, in that range, you're normal. And they just let you go on and you're still grumpy, you're still gaining weight, your sex drive is down, and you're frustrated. And you just don't feel right, but yet he says you're normal. Or let's say your thyroid. Let's say your thyroid numbers look normal, but you're not. Here at Pivotal Whole Health, under my care, I look at the whole body, the whole picture. So a young person in the 20s, their testosterone is probably going to be that 900 to 1200 to 1300. But as we get older, in men and women, those values go down, and so does your drive go down, so does your experience go down, so does you get more moody, more brittle hair, acne, hot flashes if you're in menopause. And so if the general practitioner that just looks at the lab values and says, boy, that's within normal limits, you're fine, you're not fine. If your symptoms are above and beyond what is not right, I look at that. So our computer program, we have over 60,000 people in our database with Gary's, his practitioners, probably 3,000 practitioners in the United States. I'm one of them that actually take the bioidentical plant-based hormone that is totally safe to put in your body, if you will, and it's usually a high upper rump, and it dissolves slowly over a 3 to 5 month time period. And it sits there and dissolves slowly. When the blood goes by it, it grabs the hormones and it delivers it through your body to help the fatigue, the sex drive, the fogginess, the insomnia, lots of things. When the hormones are not balanced, there's a lot more than just sexual drive here. Everybody thinks it's all about that. It's not. It's everything but that, if you will. So in the old days, when bodylifters and all that stuck the testosterone in their muscles and they got big and all that, that was really unsafe. And it's still practiced that way, obviously, today. But this is totally safe. It's a plant-based product from yam and beets, proprietary mix. So I've had people come in and they have the symptoms. Their lab values were kind of in that normal range, but low normal, but they have terrible symptoms. Well, I go ahead and get the lab values. I put them in our computer system. It's all systematically done. It's been proven. It's updated weekly. Gary's database is updated weekly. So we're about 98% spot on. So when I end up asking you all the questions, how you're feeling, and put all the lab work in here, at the end that says calculate, it tells me exactly how much testosterone to put in you, how much female hormones to put in you, whether you need some vitamin D. Everybody in the Northwest here is low in vitamin D. It's almost pandemic. So vitamin D is not there, what happens? All those symptoms are there. That's hidden inside normal values, quote, they say, right? How about your calcium levels, your vitamin D, and we talk about that, and methylating factors, and iodine for the healthy thyroid. So we put people on iodine, progesterone. Women that are in menopause, hysterectomy, we definitely got to get you on progesterone. It helps you sleep. It's unbelievable what your progesterone can do besides help your female side of things, if you will. So when you come into Pivotal Whole Health and you're here for sexual wellness, you're here for, I don't feel good, I don't know why I don't feel good, but my lab values are this, I'll figure it out. And that's what we do here. So I look forward to seeing you and be a part of this group. We'll be on Facebook, we'll have a website, we'll have this video posted, and we'll probably have a chat room where people are starting to get this, and people are loving it so far. I've had people throw away most of the medication because the darn thyroid and the BioTE hormones have reversed the disease process that nobody else was looking at. And it's a simple fix, folks. It's a simple fix. And what I want to show you here before I leave is these are the nutraceuticals that BioTE has patented that can help, if you will, jumpstart your hormone therapy. You're looking at the iodine, which I mentioned, and the curcumin for pain, and methyl factors. You're a little toxic in some of the let's say iron or arsenic or something like that. Just low levels, something like that could help clean up your cells, if you will. And the DMS and ADK 5 and 10. You're talking the vitamin D, the probiotics for gut health. If you do not have this, none of this is really going to matter. Your belly, your lining, your natural occurring probiotics have got to be balanced. If not, it bypasses your intestine. It goes right out the other end. So you're paying all that money for whatever it is, or a Walmart, or wherever you're doing. And if your stomach is not in good health, none of this matters. So that is paramount, that you have good probiotics on board. Whether you have bioidentical hormones or not here, that is definitely have to be. So omega-3s, CoQ10, heart healthy, right? We talk about that. Arterial sol, that is because, of course, it's called arterial because our arteries in your heart, your head. You want the lining to be nice and smooth like Teflon. You don't want it to be jagged. Let's say you're diabetic. I'm going to put this down. Let's say you're diabetic and you say, boy, I don't mind my sugars getting up to 200-300. I just take insulin. I still want my ice cream. Well, I tell the folks, okay, let's say you have that high sugar content. And if you look under electron microscope, sugar looks like a charred piece of glass. Kind of like when you have a windshield accident, you see all the pieces of glass on the ground. Can you imagine those circulating to your bloodstream? And they're nicking your arteries. And the cholesterol, what is it going to come? It's going to come along and go, and then block it, and you got a heart attack, a stroke, and all that. So a product like that helps that inflammatory process in your intima, or your lining of your arteries and veins, to be more Teflon-like, if you will. So, like I said, we have many things to offer here just from a bioidentical hormone, and this is what it's all about. It's a great book. So whoever comes here to get treatment by me gets a free copy of this. I met Gary back in Scottsdale, Arizona last year. I had dinner with him and spent 2 days with him on a clinic. And it's actually not only bioidentical, but thyroid health as well. So we look at the thyroid, make sure you're not Hashimoto's, if you have any kind of antibodies like TPO antibodies, that people throw that around. So we find out, we optimize your thyroid. So the combination of those two things alone can help so many symptoms and so many people. So again, thank you for your time. Look forward to seeing you, and see you on YouTube, or I'll see you on the website or in my office. Have a great day.